The World Health Organization says the majority of the children with the most severe form of sickle cell disease in Africa die before the age of 5, usually from infection or severe blood loss. In commemoration of the World Sickle Cell Day, Dr. David Ajibade, the Executive Director of Brain and Body Foundation, now joins me from Lagos to discuss this and more. Dr. Ajibade, a pleasure to have you join us for this conversation on Powerland West Africa. Shall we start by exploring, first of all, why are cases prevalent in Africa despite years of awareness and measures?
Well, thank you for having me on. In Nigeria alone, there are about 40 million people with the sickle cell trait, which means their genotype says AS. So once those two get together, they could have a child with SS, and there's a great possibility of that, and we have about 4 million of them in Nigeria alone. Why is it so prevalent? Awareness is still a problem. It's still a big problem in spite of all the publicity that has been done. Many people just find out about the whole problem with sickle cell disease after they have a child with sickle cell disease, and the problem, of course, is that in many remote areas and rural areas, the awareness hasn't reached there yet. And besides, they may not even have the ability to do the genotype testing to ascertain what their genotype is. And even then, there are many labs, even in the cities, that give false negatives. And what do I mean by that? Many labs actually say that a person is AA, when indeed they're actually AS. And so they think they're okay. They get married to someone who is AS. And bingo, they have a child with sickle cell disease, and everybody's blaming everybody about it. So awareness is still a problem, and of course, the testing is a problem as well.
So what are your thoughts on coordination of efforts so far? I'd like you to assess interests at this point, especially considering at what stage does goodwill become interference with an individual's fundamental rights to associate and, of course, to choose a life partner. I ask this off the back of the fact that there have been conversations bringing in legalities as part of the measures with which to prevent rising cases of sickle cell in Africa.
Yeah, that is the challenge. It is a challenge. You can only go so far to enforce it, obviously. Churches, for instance, will not let you get married. I mean, many churches in Nigeria, I won't say all churches, if you don't do a genotype testing, it's a genotype test, and they won't agree to marry you if you test as AS and there's a risk of having child with sickle cell disease. That can only go so far, obviously. So it is a challenge, but the best we can do at this point really is to enforce maybe that tests be done for every individual at a certain stage, maybe at birth or before marriage or before they get into secondary school somewhere. But that needs to be done really to reduce the burden.
So I do know that you're doing some work with Nigerians in Diaspora Organization. Nido, could you give us some clarification on what the nature of your collaboration entails?
Yes, great. We were really fortunate to secure the cooperation. They've actually been looking for ways to give back. This is actually the Washington, D.C. chapter. They were looking for ways to give back to Nigerians and their people, and I, like I said, was fortunate to get in contact with them. So they are. We're going to have next week. We are going to have a Zoom call with their chapter, with me from Nigeria. They are also supplying funding to help with this, to help host this event. We're actually having a big event here in Abuja, where we're inviting people from all over the city in Lagos, in Abuja, in Nigeria, here, to attend. And we're giving everybody free supplements. Each of these bottles we got from the U.S. It's nothing less than $100 per bottle, and we're giving them free of charge. And some kids may require more than one, some 2, 3, 4. And the Nigerians in diaspora are helping to support this event. Of course, we have to rent the space and all the other things that go with hosting an event, and they are right there working with us to make it happen.